advise shorter breath. If you don't take it, shorter breath is very dangerous. So, do what the doctor say. Don't smoke. That is the thing. If you smoke, that someone may say, boy, come on me with the cigarette and all them way there and smoke and I say, we can't stay here, so. Smoking is no good. 2 months now.
Yes.
Since we can't talk to you right now.
Oh, so for the past 4 years you haven't really been yourself?
Right. Try do what the doctor say. And hear what the doctor say. You understand? That's why we can live today with you, having no more shorter breath. And that's why we can talk to them on the phone in church last year.
Yes.
Yeah, we go to church and get baptized and the pastor pray for me and things.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels. In Office is a program which we talk about life, sickness and death. And today in office with me is Mr. Garfield Gray, and we will be discussing heart failure. Welcome to the show, Mr. Gray.
Welcome.
Alright, good. Alright. So before we get into the introduction and the interview, please remember to share, like, subscribe, and leave a comment on this video for more informative medical content. So, heart failure is actually a condition in which the heart is unable to pump enough blood around the body to meet the demands of the body, right? So we have different types of heart failure. We have left-sided heart failure, right? We also have right-sided heart failure, and then we have a congestive cardiac failure, which is basically the entire heart fails, right? Now, if we know about take it back to how the structure of the heart is, the heart actually have 4 chambers, right? We have the two on the left and 2 chambers on the right. So the left side of the body is basically responsible for receiving blood from the lung and then pumping that blood to the rest of the body, so to the brain and the limbs, right, and the organs. Now the left side of the body actually receives blood from the rest of the body, and then it actually pumps the blood to the lung to be oxygenated, right? So remember, the lung is the organ that has the oxygen to the lung. So we can see that the heart actually is a 2-sided organ, which actually is pumping the blood to 2 different sections of the body for different functions, right? Now, in terms of the causes of heart failure, you have different disease which actually put you at higher risk of developing heart failure. The first one is coronary artery disease. The coronary artery disease is actually when the blood vessels to the heart actually becomes start to be partially or even can be completely blocked, right? So when we develop like what we call plaques in the vessels, then we have decreased blood flow to the heart muscle, and that's a condition called coronary artery disease, and it's actually put you at increased risk of developing heart failure. Now you also have a common disease such as hypertension that is very common in the population, puts you at increased risk of developing heart failure, right? And you have other issues such as other disease such as dilated cardiomyopathy, and you might have a myocardial infarction. So some persons that have a heart attack further goes into developing heart failure. Now some persons may develop heart valve disease, which can lead to heart failure as well. Some persons were born with congenital heart disease, so they develop heart failure from a young stage. But some persons might develop heart disease they had previously, like how infective endocarditis or rheumatic heart disease can develop valve problem, which then leads into heart failure. Now the symptoms of heart failure normally includes shortness of breath, especially on exertion. However, when the heart failure becomes really bad, you can even have shortness of breath at rest, and you have can even have difficulty lying flat and the bed to sleep, right? You have to actually sleep up on pillows, so the short of breath can actually get that bad. Now the patient may also feel fatigue, so they have low energy. and actually not having enough energy to do regular activities that they normally do. Even simple activities such as walking, they probably find difficult because of how weak they become, right? Also, some persons may have swelling, especially in the legs, lower limbs, and some persons that are bedridden or probably stay in bed a lot may also develop swelling to the sacral region, that's the lower back, which basically would be the lowest point in their case. Now, you may also have some persons may have wheezing and a chronic cough from heart failure. These are some additional symptoms. Also, some persons may develop what should I say now? Some persons may develop what we call PND, what is paroxysmal nocturnal dyspnea. Is also a symptom in which the person may wake up from their sleep to catch breath, or they may actually have to sleep upon pillows, which we call arteries. Some person may be sleeping on 2-3 pillows. Now, in terms of the diagnosis for heart failure, find that today we use, apart from the history and the physical examination, we use what we call an echocardiogram to diagnose heart failure. So the echocardiogram normally gives an indication of ejection fraction. And ejection fraction is basically the amount of blood, the fraction of the blood that is pumped from the heart during each heartbeat. Now, an average male with a normal healthy heart would have approximately about 100 mils of blood in their heart, and approximately about 60 mils of the blood is actually being pumped out. So on average, the normal ejection fraction for a person that does not have heart failure should be about 50 to 70%, right? Persons with heart failure have significantly reduced ejection fraction, so they may be 40% and below. We classify them as having heart failure, right? Now, in terms of diagnosis, some persons will also do ECG, and some persons may actually do blood tests, and some persons may even do different stress tests, right? Now, in terms of treatment, normally the medication that we use to treat heart failure, sometimes depending on the underlying cause of the heart failure. So the personal major risk factor for the heart failure is like high blood pressure, so we're definitely going to treat the hypertension and try to bring back the pressure in a normal range, which would put less strain on the heart. But definitely, some of the mainstay of treatment is also medication to slow down the heart, which have beta blockers such as carvedilol. We also give diuretics such as furosemide, and these medication, the water tablets, help to reduce the amount of water that is in the patient's body. Because whenever a patient has heart failure, the body is unable to actually pump the blood effectively around the body, and the excessive fluid tend to pool up in the body, in which if it pools in the lung, it's actually causing the shortness of breath. When it pools in the leg, it will cause the leg swelling. So actually giving medication to remove the fluid is actually a part of heart failure management. We have additional medication, but this video is not going to be focusing so much on medication. We'll have an additional video in the future to talk about heart failure medications. Now, in terms of complications of heart failure, so even though heart failure itself is a complication of can be complication of other diseases such as atrial fibrillation or hypertension, having heart failure itself now can result in other organs failing. So it can develop in kidney failure, can result in kidney failure. Having heart failure can also put you at risk of developing liver failure and also actually respiratory failure. So your lung can fail as a result of heart failure, because all these organs tend to act closely with each other to maintain life. Having heart failure also put you at increased risk of sudden death, and so some persons' heart failure can just have a cardiac arrest and die sudden. That's also a possible complications of heart failure. Now, in general, how do we prevent someone from getting heart failure? So, heart failure, like many other diseases, actually have certain lifestyle changes that reduce the risk of developing these problems, such as diet and exercise. So normally you should have a balanced, healthy diet and increase the amount of physical activities that you do. So in terms of the person have a non-active job, they should actually have an exercise program going on to keep active, to decrease the risk of cardiovascular diseases in general, including heart failure and heart attack, right? Also, you should have get enough sleep, so at least 7 to 8 hours per day. Additional stuff that you can do to prevent heart failure is to decrease your stress level. So in terms of person have excessive stress, they should try and do leisure activities in order to decrease their stress level. Also, for persons that smoke, they're at increased risk of developing heart failure and other heart diseases. And so it's good to try and quit smoking as soon as possible, because the earlier you quit, the faster you will reduce the risk factor for developing these stuff. Alright? But with no further introduction to the case, I just want to now get Mr. Gray involved in the discussion on heart failure, because he's a patient with heart failure, and he's actually now living the whole experience of heart failure, from the initial severe symptoms that he had to now he's basically controlled on his medication. So Mr. Gray, once more, welcome to In Office. Alright, good. Alright, what are some of the symptoms that you're having at the time when you seek medical attention?
Short of breath. Find the doctor.
Okay. So how severe was the short of breath?
5 years ago.
No, the severity I'm talking about. No, how severe, like you were so short of breath that you were unable to work, unable to speak.
Right. Couldn't speak. Couldn't work.
Feel like you were dying.
Yeah, man.
Okay.
Feel like I was dying.
Okay. Alright. So did the short of breath gradually get worse, or it started sudden?
Come again?
Initially when you developed the shortness of breath, was it a sudden onset shortness of breath, or you were noticing that it was coming on over a period of time?
Obviously, maybe, I don't know, but short of breath was taking sudden.
Sudden. Alright. Did you have any chest pain at the time?
No.
No chest pain. But you say you had a cold as well at the time though?
Yeah.
First time?
The first time, until now.
Okay.
But right now, then I have to go to the doctor. I explain to them what give me the short of breath. It was cold on my chest, so I cannot breathe.
Okay, got the cold on the chest.
Yeah.
Alright, but did you have any additional risk factor for heart failure, such as high blood pressure?
Yeah, blood pressure really high.
So were you taking your blood pressure medication and your pressure was very high?
I was taking it.
But were you checking on your values to ensure that your blood pressure was controlled on those medications? No? Alright, good. So sometimes it's not just to take the medication. When you're taking medication for blood pressure, you also have to be checking the blood following up at the clinic and ensure that when they're testing the pressure, it's within the normal ranges. You probably need to change the doses of the medication.
Yeah, because enough time I'm going to go to the clinic and him test me.
Yes.
And him say,
The pressure?
The pressure high.
Was still high?
Still high. And then give me pressure tablet.
Okay.
Take me off that one and put me back.
Okay. So apart from the coughing and the shortness of breath that you had at the time, did you have any other symptoms that I discussed earlier, such as the leg swelling, feeling tired and weak?
I was weak.
Weak.
Tired. God shot and they can give me the tiredness.
Okay.
You can give me the tiredness. You understand?
Yes.
So.
Alright, so what about chest pain? Did you have any chest pain?
No, I never had.
Feel like your heart was racing?
Yeah.
Had heart racing issues as well?
Yeah.
Okay. But you didn't diagnose it with any other heart condition apart from the heart failure? Like irregular heartbeat?
No.
No? Alright. Now, so tell us about your experience the time when you were admitted first at the hospital. What are some of the medications that you got? Was there other persons there with similar health conditions?
Yeah, when we go in the hospital the first time, 1 week I spent in the hospital.
What are some of the medications that they were giving you?
Well, I can't recall right now, you know. But I know that we get some
Water injection?
water.
Or water pill?
Water pill. Sometimes I bore me and put the medicine in
The drip?
a drip and give it to me.
So the shortness of breath had improved at that time?
Yes, because the water pill what them drip, yeah. You see it. And them put on all PP bag.
Oh, so you're that ill?
Yeah.
You're severely ill then? If you had to monitor your urine?
Yeah.
PP bag. Alright.
Yes.
So at what point did you get the echocardiogram? That's the ultrasound of the heart. So I'm not talking the one that they pin the stuff on you, not the ECG, but the echo to tell you the percentage function of the heart. Did you get that the first admission or you had to do it?
You have to go to road and do it.
Okay, the machine wasn't working at the time?
No.
Okay, alright. So that was the cost that you can remember the cost that they had to pay for the echo at the time?
21,000.
21,000. Okay, alright. So you can see that it was very costly for you from the first.
Yeah.
Alright. So what was the ejection fraction or the percentage function of the heart that they had told you from that echo? That 21,000 that they spent?
I carry the 3 times we get them carry it and they don't tell me nothing.
They don't tell you the function
No.
of the heart? I thought you were saying that it was 11%. That's what I'm asking in
Yeah,
the ejection
but-
fraction.
Yeah, but when we go at the doctor, them tell me say 11%.
11% function?
11% function.
Okay. Well, this is ejection fraction. So normal, as I said before the election, ejection fraction should be about 50 to 70%, and you're saying that yours was 11%.
Yeah.
That's why you're severely short.
Yes, that's
short
how
of
we
breath.
shot.
Now, how was it affecting your day-to-day activity? So when you were discharged from the hospital, were you able to go back to work at the same time?
No.
Well, what was the issue? You weren't like feeling as strong, or you still?
Never feel strong. You understand? Till taking the medicine and thing. Because the last time I gone down by the clinic
Yes.
and the doctor them shook up them feet and said prostate getting large.
Oh, but that's an independent problem, but they have
Yeah,
prostate
yeah.
problem as well.
Yeah.
Okay.
But
Yes.
me not have it again.
Okay. No, I'm talking about, I'm trying to ask you about, like when you were discharged initially, when you were diagnosed with the heart failure, at how long did it take you to go back to work? How long you had to take the medication to feel strong again and to have less shortness of breath?
I mean,
Like 1 month, 2 months, a year?
no. Around yeah, 1 year. 1 year.
You were unable to work for a whole year?
Yeah. I tell you.
Okay. So in that year, did you see a cardiologist specialist, a heart specialist?
Yeah. That's why they sent me, they give me the paper for go to the outside.
So you had seen a specialist for the heart,
Yeah.
and you were still unable to work for a whole year.
Yeah.
Okay. So what type of work did you do, man?
Taxi drive.
Taxi operator.
Yeah.
So you're unable to drive because you're so weak and short of breath.
Yeah, because
right?
man is do the promotion with the NG and so.
Okay.
But right now, you can ease off because it costs me a night time to go out and to come in later morning time.
Okay.
And they give me this girl and then forget her.
Okay.
So we just
So-
try to avoid it.
Okay. So in this 1 year when you were unable to work, what was happening? You were admitted in the hospital on a regular basis?
Yes.
So how many times you had admitted for that first year?
First year,
Mm-hmm. In that first year when you had the heart failure, how often you're admitted at the hospital? Every week, every month, every 2 months?
Every 2 weeks.
Every 2 weeks you're admitted? So what was the issue there? When you went home with the water pill, they weren't working or you weren't compliant with fluid restriction? What was the issue?
So we take it. The water pill. Still have it. It's all like camera stuff.
Alright. Normally when you have heart failure, we tell the person to limit the amount of fluid that they drink for the day, water and juice and tea, to at least one of those tall but 1.5 liters, no more than that. Were you compliant with the fluid restriction in that first year?
Yeah.
Were you still having shortness of breath? So at what point did the shortness of breath go away? What I think was the one of the medication that you got, or it was just time?
Right. It was time, you know.
Just time.
It was time.
Alright.
But still yet, I am taking the pill and what I get from them same way. So when some of them really have the effect, but I don't know which one of them.
Okay. No. So you were compliant with the medication as in you were taking the correct dosage and correct frequency of the medication in that first year? And I'm still a little surprised that you were actually had to take a whole year to resolve the initial serious symptoms.
Since our 2 months now.
Yes.
Since I can't talk to you right now.
Oh, so for the past 4 years you haven't really been yourself?
Right, and since we go down now. When we go down January.
So what had happened since January? You got new medication or increase the dose of medication or what?
Why? The doctor give me the medication.
Okay.
I can't remember the name of it.
But Mr. Gray, you need to learn the name of your medication and the dosage, you know, just in case you admit at the hospital or you go to a doctor and you know have the prescription or remember it's good to know the name.
Always carry them.
Okay, always bring your medication. Alright. Now, for you not to be able to work in for 1 year and say, for example, you're the breadwinner for your family, how did it affect like emotion and mental?
I remember of my people, I don't know.
Okay, that's how you would cope. Alright. So who are some of the persons that had rally around you full time and to help you manage throughout this first year when it was so difficult?
So she.
Your wife? Good. It's a good thing that you're treating her with love and respect.
Right.
Good. That means that she's still there when you're down. Alright? I'm happy for you, alright? Where that is concerned. So, in terms of clinic follow-up now, how often do you go to the clinic, the heart clinic or general medicine clinic? You see, the last visit was in January, but how frequent, like how many months normally in between each visit?
I mean, I'd say every month, you know.
Every month?
Every month.
Or every 3 months? Normally not.
Because we only feel and we short of breath, and we have to fly out back.
Okay, not admitting at the hospital, no, like the clinic follow-up when they see you in the clinic.
When we go to clinic. We go to clinic very often. Very often.
So they normally change the doses of the medication or different change the medications in general, especially if they have any side effects to anything?
Yeah, because they always, when they check for me, sound me and all in for something.
Yeah.
They may change it. But sometimes when we go in and it's inside to the doctor, so I have to sit down, wait until the name call.
Yes.
You understand?
Yeah.
Sometimes I have to try beg someone to get an early number for me.
Okay. I know for some heart failure patients, especially in Jamaica, the time is very hot. How do you manage to maintain the discipline to drink less water?
That worse. Cause can't sleep at night time. We have to come from the veranda and lie down. Catch the air.
When you don't,
Right.
when you drink a lot of water.
Right.
Okay, so that is so that alone let you don't drink a lot.
Right.
And you want to prevent the shortness of breath.
Yeah.
Okay, right?
And eventually, when we tell the doctor what, give me the shot of breath. If I give me the antibiotic,
Oh.
I can talk to you.
Oh, so you had a pneumonia, chest infection with the heart failure as
Well, you
well.
know,
Shana, because normally the antibiotics is by infection, you know, so we would give you antibiotics for heart failure, so you must have had a pneumonia as well.
They never tell me, I tell them mommy, Pierre called me after I speak.
Okay. Yeah, because pneumonia is one of those infection that worsen heart failure. You know, like if you let the condition get worse, right? Now, but let's sidetrack. In terms of, you said the initial ultrasound that they did was 11% was the ejection fraction.
And they tell me,
So, yes, but over the 4 years, have you done subsequent ultrasound and the ejection fraction improved? Because now you say you feel better.
for a
So.
long time, I can't remember all those things, you know, because I know say me go through a whole heap of them.
Okay, they don't remember the numbers. Alright, I'm not gonna stress you because it's medical things, even though you have the condition, you're probably not as versed with all the different medical terms and percentage, alright? But based on what you're saying, it seems like this heart failure has been very stressful to you. So,
Yeah.
what are some of the coping mechanisms you use to manage the stress levels that you have over these past 5 years?
Stress.
Yes, I mean, like, it sounds stressful that you're at home 1 year and then you have short of breath from time to time. So that in itself, thinking about it, you must probably have some form of stress. You must have been doing something to relieve the stress. Like some person may go to church, some person may pray, some persons may go on leisure activities. What did you do to cope with this stressful period?
We have let's call it now. Go to church.
At the church?
And I'm trying to go to church last year.
Yes.
Yeah, me go to church and get baptized and pastor pray for me and thing. A couple of weeks now me not go to church.
Okay.
You understand? So you can try to live up to what them say auntie.
Okay.
Yeah.
Yeah, but if you say the pastor pray for you and touch your heart and you get better, so why would you not want to go to church every week if you see that as a big part of your recovery and your coping?
Well, sometimes I tell them I'm really tired.
Okay.
I'm getting some sleep and
Alright.
tired.
So in terms of
And an easy thing when we go to church, to go up on them step there. You understand?
okay. Alright. Normally persons with heart failure tend to have a decreased life expectancy. Did the cardiologist or anyone, if a doctor discuss like lifespan with heart failure with you?
No.
I didn't discuss that, right? Good, right? And so in terms of your day-to-day activities, no, you're back to full function now.
Not really.
No, oh, so you're not back to 100%.
No.
So how have life been? How was life before the heart failure and after the heart failure? I wanted to compare both period of your life in day-to-day activities.
Why? Things what me always do them no more. But me have to doctor just tell me something was to take rest.
Okay.
You understand?
So before the heart failure, like how many hours sleep you were getting on a daily basis?
I don't see me getting up.
No, you were getting adequate sleep before the heart failure?
No.
You used to work in the night as well?
That time when we always work, the Angie do promotion.
Okay. Alright, but now you're getting adequate sleep.
Yeah.
Do you sleep 8 hours every night now?
We will start sometime from coming in at 5 after 5. I don't go back out unless somebody call to pick them up or whatever.
Okay. Now, in terms, I wanted to ask you about the water pill. Like some persons take the water pill in the morning because and some persons take it in the night, right? Because some persons that take it in the morning say that they can't take it in the night because they have to wake up too often to urinate. While some persons that take it in the night will say that, oh, they are going to urinate too often when they're at work or they're on the road, so they take it in the night. So which one do you prefer? Which time do you take it and why?
In the evening, when I go to bed.
But it's not going to prevent, it's not going to wake you up a lot in the night.
Yeah, but sometimes when I but I tell you, just have to just meet you anytime.
Okay. So what's the issue with taking it in the morning?
We can't take it in the morning. Just me have to stop, and it will work.
Okay, you'd have to stop too often.
Yeah.
Alright.
And therefore, when the passenger and them in the car, you have to reach our work and thing. And they will see me as sometimes it embarrass.
Okay. So I say it's prefer to take it so when you reach home you take it.
Yeah.
And then hopefully by 12 o'clock you can get some sleep.
Yeah.
Alright, so viewers or persons with heart failure, at least my guest here say he prefer to take it in the afternoon, the water pill. At least then it doesn't affect him as much in the day. Alright? Alright, that's a good point. Alright, any final word for the viewers, Mr. Gray, with persons with heart failure, how you're coping overall, any advice from other persons with heart failure, as in how you're able to manage?
Doctor have advice in shorter breath. If you don't take it, shorter breath is very dangerous. So, do what the doctor say. Don't smoke. That is the thing. If you smoke, that someone may say, boy, come on me with the cigarette and all them weed and the smoke, and I say, we can't stay here, so. Smoking is no good. It is no good, so try do what the doctor say and hear what the doctor say. You understand? That's why we can live today with you, having no more shorter breath. And that's why we can talk to them on the phone and
Program, by the internet, the media.
the media. We can't talk to them. But do what we have to do. Stop smoking. As I was in the hospital many times for shorter breath. And I ball like living baby. Shorter breath. So thanks for the doctor then. And we can get out to the media right now. You understand? So do one of you do. And no cigarette at all. Thank you very much.
Alright, viewers. Alright, so once more, let me just finally say a special thank you to Mr. Gray for taking time out of his busy schedule to come and share his health condition with the world. And as usual, I want to say I'm very, very grateful for all the guests that come on this show to share their story, their health condition, because without them, this show would not be possible. And without them, some persons would not benefit from hearing the life story of a person. And I hope it really benefits those who have similar condition or those who have conditions that actually are risk factor for developing heart failure. So please remember again to share, like, subscribe, and leave a comment on this video. Until next time, stay tuned. Thanks very much for coming, Mr. All right.